Hello, it's Dr. Rhonda Johnson. Today is Monday, January 11th, 2021. And today I'm going to be talking really about updates regarding the COVID-19 vaccine. The good news today is from Pfizer, and that their vaccine is effective against this new super contagious mutation of the SARS-CoV-2 virus. And that was confirmed by the independent lab at the University of Texas. Now, again, even though this virus has mutated, I want to remind people there are going to be a lot more mutations because viruses mutate. That's what they do. Now, there was an update from the World Health Organization. It had to do with pregnant women. Now, it is recognized that pregnant women are at a higher risk of severe COVID-19 disease than non-pregnant women. And COVID-19 has been associated with the increased risk of premature birth, preterm birth. So these vaccines, neither of these messenger RNA vaccines were tested on pregnant women. And so at this time, the World Health Organization does not recommend the vaccination of pregnant women at this time. Now, they do allow for pregnant women to discuss with their personal health care providers, should they be women that have high-risk occupational exposure, for example, a healthcare worker, so that vaccination may be considered on an individual basis. Now, the CDC recommendation is a little bit different. They basically say pregnant women, if you're part of a group that is going to be vaccinated, like healthcare personnel, that they may choose to be vaccinated, and that they should have a conversation between the pregnant woman and her healthcare provider around whether or not she gets vaccinated. Now, for breastfeeding women, both organizations, the CDC and the World Health Organization, recommend continuing to breastfeed if you get the COVID-19 vaccine. Now, for children, there's also agreement between the World Health Organization and the CDC. The vaccine has only been tested in children above 16 and up. The Pfizer vaccine was approved for 16 and up, the Moderna vaccine for 18 and up. And they don't recommend immunizing children younger than 16, even high-risk children. Now, people are still questioning, can you mix and match Pfizer and Moderna vaccines? The answer is no. Folks, if you get the first one and your first dose is Pfizer, then your second dose needs to be the Pfizer vaccine. The same thing with Moderna. If your first dose is a Moderna vaccine, then your second dose needs to be the Moderna vaccine. Now, there's a lot of ugly rumors going around on the internet about what's in these vaccines. So I went to the FDA website again, and for verification, what's in these messenger RNA vaccines. First, there's the modified RNA itself. And then there's what's in this lipid nanoparticle, that carrier delivery device. Those are lipids, those are fatty things, including cholesterol. There's some inorganic buffer salts, because again, the protein has to be stabilized, sugar and water. What's not in these vaccines, folks, are heavy metals, no cellular products. There's this big rumor that these vaccines contain aborted human fetuses. No, it's not in there. And there aren't any animal products in these messenger RNA vaccines. Period. Put those rumors to rest. Next. President-elect Biden plans to release all the available vaccines. A couple people have asked me, what do I think about it? I really think it's a good thing. I think that's the right decision given what we're facing. With the super contagious variant coming and so many people getting sick and the hospitals are being full. And really the rollout hasn't gone that well. So what's this going to mean? It means that everybody who wants a vaccine will be able to get their first doses. Now, the Kaiser Family Foundation, they've been surveying Americans almost monthly, and their most recent survey was December 15th, and they found out that a large majority, almost 71% of Americans, say that they will definitely or probably get the COVID-19 vaccine. My guess is this number is going to be higher. I think we're going to see a massive turnout for these vaccines once they become available. Now, I think there's going to be a little bit of confusion, to be quite truthful, as the states try to put plans in place to administer this vaccine to so many people. I think we're going to see mass vaccination clinics. I think we're going to see vaccine being distributed at the federally qualified health centers, the community clinics, pharmacies, and doctors' offices. Now, which one should you get? Again, you should get whatever one is available. Now, while we're talking about vaccines, I think it's very important to say that with so many people getting the vaccine, you can expect that there's going to be some type of adverse event. And it could be something local, like a soreness at the injection site, or pain or redness, or it could be something like a little bit of a fever, or muscle aches or soreness or fatigue. So you should be prepared for that, and you should be prepared to hear people talk about that as well, and that should not surprise you at all. The other thing I want to mention again is to be patient. It could be that when you go to get your vaccine, you're going to be waiting in a long line. And again, I want to repeat that any vaccine symptom that you experience will be milder than actually getting COVID-19 of serious illness. So that's really what I wanted to message today. Oh, one more thing. I do have a request. There's an important concept in health education, and that's to understand the differences in knowledge, attitudes, and health beliefs amongst subgroups of people. So I have a request, because in order to be more effective, you have to understand what these differences are. So I'm hoping that you'll interact with me on this. What is needed? What kind of information do you need? Do you need knowledge? I know there's a lot of information out there on this pandemic. Is it health beliefs, or is it attitude? What is it? What is it that you are hearing people talking about in terms of these vaccines and this pandemic? I would really like to know. So leave me a comment, please. Okay, that's it. That's my message for today. My views are my own. Don't intend to be a substitute for any conversation that you would have with your own personal healthcare provider. More than ever during this pandemic, it is so important to have a relationship with a healthcare provider. And as always, my views are my own. Stay safe and have a blessed day.